The global mental health crisis can no longer be ignored. The world is facing a mental health emergency that can no longer be viewed as secondary to physical health, economic recovery, or social policy. According to new findings published in the Lancet as part of the Global Burden of Disease Study 2023, an estimated 1.2 billion people worldwide are now living with a mental health condition. Anxiety and depression alone have risen at staggering rates over the past 3 decades, increasing by 158% and 131% respectively. Behind these numbers are human lives, young people unable to cope with overwhelming pressure, parents silently battling exhaustion and emotional distress, workers struggling through burnout while trying to survive rising living costs. Survivors of abuse, violence, bullying, and trauma carrying invisible wounds that often go untreated for years. The statistics are alarming, but they are not surprising. For many communities across the world, mental health challenges have become woven into daily life. We are living through an era marked by uncertainty, instability, and constant psychological strain. From the long-term emotional impact of the COVID-19 pandemic to economic hardship, war, social isolation, climate anxiety, and widening inequality, millions of people are navigating pressures that previous generations could scarcely imagine at this scale. What makes this crisis even more concerning is that mental health services have not expanded at the pace required to meet growing demand. Across many countries, support systems remain overstretched, underfunded, and inaccessible to those who need them most. Long waiting lists, rising thresholds for support, and shortages of trained professionals mean that many individuals only receive help once they have reached crisis point. This reactive approach is no longer sustainable. Mental health must be treated as an essential part of public health, not an optional add-on. Early intervention, prevention, and accessible community-based support are critical if societies are to respond effectively to the growing burden of psychological distress. Waiting until individuals deteriorate before offering support carries enormous human and economic costs. The consequences are felt not only by individuals, but by families, workplaces, schools, healthcare systems, and entire economies. Particularly troubling is the report's finding that teenagers aged 15 to 19 now carry the highest mental health burden globally. This should serve as a wake-up call to governments, educators, and healthcare providers everywhere. Young people are growing up in an environment shaped by social media pressures, academic stress, financial uncertainty, online bullying, and global instability. Many are expected to navigate adult-level emotional pressures without the emotional tools, safe spaces, or support systems necessary to do so. At the same time, the unequal impact of mental illness on women and girls demands urgent attention. The report highlights